So welcome tonight to our Prime Cognition talk. We've been working on this talk for several months and we are super excited to present it to you. This is really a talk that's going to be delivered and facilitated by Annmarie McManus, my star colleague at Philadelphia Integrative Medicine. But she has asked me to just give you a context for the talk, which is a little bit about what is integrative and functional medicine as an approach. So we'll briefly touch on that and dive in. So working with the functional or integrative medicine provider is an excellent way to focus on wellness and also to focus on the underlying root cause issues that are causing imbalances, causing symptoms, causing us to seek out medical attention. So there's a lot of factors that influence why we feel well and why we feel unwell. So we're very interested in those underlying issues, and that's how we've structured the talk tonight, to actually take a look at some of the underlying issues that sometimes are not addressed, teased out, examined, and actually worked with and improved so that we actually feel better. So in functional medicine, we're going to assess fundamental imbalances in these areas and others. So we've mentioned environmental inputs, which are really important, mind-body connection, and connections and genetic makeup. One thing we want to express to you is that it is possible to change the way that your genes are expressed. So we are born with a genotype. All of our genes are fixed. They're not going to change. Those are determined when the sperm meets the egg. But the way your genes are expressed are constantly changing according to your lifestyle choices and according to these other inputs that we'll talk about tonight. Many of you have heard of methylation if you come in as a patient. Anyone heard of methylation? Okay. So methylation is literally the way that DNA is changed so that DNA expresses differently. So when you exercise and your body changes, when you eat differently and your health improves, those changes are mediated by methylation. So methylation is a process where your DNA is actually affected so that gene expression is different. So your muscles are different and you feel different, your gut, all inflammation, many factors are affected. So functional integrative medicine is a comprehensive approach to treatment. So most imbalances can be addressed, and this is the best news of the evening besides the entire talk that Annmarie will give, which is that most imbalances can be addressed. And some can be completely restored to optimum function. Others can be substantially improved. Our approach is very prevention focused. I think many of you already know that. And functional medicine will expand our toolkit. We have many more tools than a purely conventional approach. So we are conventionally trained. We have all of the credentials, but we have the additional training and the additional tools to be able to offer you options, often less invasive and very effective options, and also to affect very different outcomes when a conventional approach is not as helpful. So some of our approach options include medications, which we prescribe as needed, botanicals, nutritional supplements, therapeutic diets, or detoxification programs. And sometimes that can also be simply diet. Lots of counseling on lifestyle, exercise, stress management. And what we really aim to do is inspire ourselves and inspire our patients. We seek to partner with you. And that's also why we encourage people to have a membership, which is 8 appointments over the year. At least 2 of those are with our nutritionist, because it takes an ongoing relationship and an ongoing engagement to see the results and actually have that gene expression change. So we want you to know that you are a major player in determining good health and feeling well. This is our team. So this is actually just some of our team members, right? These are our providers, but our team is actually much bigger. We have a wonderful team picture on the website, very proud of. So Lauren is on the left. Annmarie on my left, and Rachel. So, but without further ado, I wanted to introduce Annmarie. And Annmarie has contributed greatly to our practice, and I wanted to call out a few ways that she's done that. So Annmarie joined us last summer, and she's certainly an expert on hormone balancing and seeing the person as a whole, from adrenal health to gastrointestinal system, really seeing and engaging with patients and with a very deep relationship. And also bringing her skills as a physical therapist to a lot of neurological and musculoskeletal concerns, and also to pain. So Annmarie is a resource to our practice. I feel it more and more the more we work together and the more I feel your depth. And I'm so glad to be working with you. So without further ado, she'll take over.
Thank you very much. Well, welcome everybody tonight. Thank you so much for coming out on a very, very nice, hopefully weather will continue night. So what are we going to talk about? I'm going to do some brief stuff on Alzheimer's, but this talk is not about Alzheimer's. It's about your brain. But I wanted people to understand why this is becoming such a prevalent issue. It is the third leading cause of death in the US. It is the #1 leading cause of death in the UK. Now I want everyone to raise their hands. Everybody raise your hands. This talk is 90 minutes long. 1 out of every 66 seconds, everyone's diagnosed with Alzheimer's. So everyone put your hands down, which means by the end of this talk, we will all have been diagnosed. Pretty scary numbers. Okay? 1 out of every 66 seconds. And they're saying by 2050, 16 million people will have been diagnosed with Alzheimer's. And that's Alzheimer's. That's not even putting in the group of category of mild cognitive impairment or subjective cognitive impairment. So that's the true disease. As a physical therapist, I did a lot of home health work, and I've worked a lot with Alzheimer patients and with their families, and it is a devastating disease when you get to that point. The caregiver burnout is huge. The caregivers, their whole lives, their whole health is affected. The Alzheimer patient themselves, their world is changing so dramatically, and it's such a challenging disease, and we really need to start thinking about what do we do now so that this doesn't become a catastrophic disease for our country and for the worldwide. So this is what we're having the talk tonight. It's like, what can we do before we get to this disease? 15% we said of the population is at risk, but that number is very, very low. And the reason is because diabetes increases your risk of Alzheimer's. It increases the risk about 2 to 5 times, depending on which research you read. Diabetes right now, there's a report that just came out right now that we have 100 million people in the US that are diabetic currently, but I think it's very underestimated. And there's 85 million that are pre-diabetic. There was one report that I read that said 50% of all Americans have blood sugar instability and are on the pre-diabetes spectrum, which puts us at this huge risk of this Alzheimer, very expensive, traumatic disease. One statistic, I have 3 children, and one statistic that scared me about 5 years ago when I heard it was 1 out of every 3 kids today under the age of 12 will be diabetic in their lifetime. So we throw that on top, and then we have the Alzheimer's perspective. We really need to make some changes in our health and stuff. And so that's at Philadelphia Integrative Medicine. What we really strive to do is let's get to the root right now. Let's get down. Let's get really into what we need to do in our lifestyles to start changing this so we don't have diseases. Because we know in our medical model right now, when you have a disease, we try and find a drug. We don't want to have disease. We want prevention, no drugs, no intervention. We want lifestyle, really good lifestyle habits. So that's sort of the kind of the talk about some scary stuff. So Dale Bredesen, who has read this book? How many people have read this or heard about this book? Heard about it? Okay, great. There is actually, you can get the Kindle, you can get kind of the Cliff Notes version of this, or if you want to read the full book, it's a great book. Dale Bredesen is a neurologist. He's a researcher, though. And he basically started to do some research and wanted to kind of fix this disease. And he was initially involved with, I don't know why that all of a sudden popped up there. Here, let me just kind of clean this. There. Oh, okay. I'm going to come back to this book here. So he basically came up with some ideas, and he was working for some drug companies and trying to figure out, okay, what do we do to fix Alzheimer's? And he looked at some drug trials and stuff, and he got frustrated. And so he kept on doing more research and stuff. And in 2014, he took 10 patients because he kind of developed this sort of program. And he goes, I think this is going to work. And these 10 patients, a few of them had Alzheimer's, a true diagnostic Alzheimer's disease. Some of them had this mild cognitive impairment, and some had subjective cognitive impairment. And between 3 and 6 months, out of those 10, 9 of them improved. The one that didn't improve was someone who was quite progressed in the Alzheimer's disease spectrum, but did see improvement, but not significant enough for statistics. Since then, he has actually found that all of them continue to improve. We're going to hold questions till the very, very end, so we have a lot of time to kind of get some good dialogue in. And 4 years later and stuff, he's still seen improvement in all these patients. 6 out of those clients were not working at all. They are all back to full-time work. So I think it's pretty, incredible statistics when you start to see that, wow, it may have been a very small sample group, but look what changed over 3 to 6 months. And this was not a drug that he used at all. So it was kind of really shocking to the medical community. They're like, what? You got some changes? And it's being reproduced over and over again. And now he's up to about 1,500 people that are in his study right now, and he's still continuing to work and fine tune and stuff with this. So that kind of goes to what he's starting to do. MPI Cognition is Dale Bredesen's company, his research institution, and he has developed what's called a Recode Program. So this is Dale Bredesen's Recode Program. It is a program that kind of inputs all of his research into one area. He's now training clinicians so that we can start implementing this up into the community and making community changes and stuff. So the Institute for Functional Medicine and MPI Cognition are running these Recode programs for clinicians so that we can all be trained and then bring it out to the public, to you. So we'll talk a little bit more about the Recode program, but you might see Recode or MPI Cognition in the media and stuff now. So let's talk about the brain a little bit.
I have a question. Do you
Yes.
take it in the middle of the presentation, Annmarie?
Yeah.
Are you certified in the Recode program?
Well, yes, I've taken the Recode program. I guess we're calling it a certification at this point in time. Dale Bredesen, it may do some more further program training and stuff, but right now, yes, I've gone through the program with them, and it was a fascinating time to do it and stuff. And we continue to work with his group to keep my skills up with them. So we're going to talk about the brain. So Alzheimer's, I'm going to throw some of the Alzheimer terms still back in and stuff. Alzheimer's is actually a normal response in the body. It's a protective response in the body. So we've all heard about amyloid plaques and neurofibrillary tangles and stuff. But it's the plaque. We always hear, oh, the plaque's in the way, and so now the nerves can't get the signal across. Oh, so that's why we lose our memories and can't create new memories. Amyloid isn't bad. Amyloid actually is there as a protective response in our body. And so people, oh, we have to get rid of amyloid plaque, get rid of amyloid plaque. And that's what the drug companies have tried to do, is let's get rid of amyloid. It hasn't worked at all. So because it's the body's natural response. So the Alzheimer's is actually, the amyloid plaque is a protective response basically due to three main things: inflammation, lack of growth support for the brain, and exposure to toxins. So one area and stuff, these are all the areas that we're looking at here. This is the functional medicine approach. So we're not even actually looking at the brain. We're looking at all the impacts to the brain and how this causes the damage in the brain. So one area is the microbiome. So the microbiome is in our gut, and our microbiome is part of our gut integrity. It's where we make our neurotransmitters for our brain to feel good. It's where we create some like where our nutrition comes in, and we absorb water, and it's just the microbiome is kind of our housing of a whole bunch of good bacteria, also some bad stuff too. But the microbiome is a key area that we tend to look at because the integrity of the gut also relates to the integrity of the brain. So we have this blood-brain barrier. Well, our blood-brain barrier is very similar to the gut barrier. When we start seeing leaky gut or dysbiosis in the gut, we tend to see that happening up in the brain. And then the brain responds like it should. It gets inflamed, it gets irritated because something isn't right in it. It shouldn't have been created a leaky surface. So inflammation, as soon as we get inflammation can come from numerous things. It can come from toxins and infections. It can come from too high blood sugar. But as soon as we get inflammation, our immune system goes, uh-oh, there's a fire going on. Let's start putting out the fire. But their immune system overregulates itself. And it's like, okay, put a fire here, put a fire there. And that upregulating of the immune system starts to create havoc in the brain. And the amyloid goes to try and dampen down that immune system and that fire. And that's putting more amyloid down, which we said we don't really want a ton of. We want some, but not to that extent. The mitochondria, they're basically these little engines in every single cell in our body. And there's a lot of things that can damage the mitochondria. So when we start seeing that damage, that can occur anywhere, in the brain, in the body, in the muscles. Toxins, like we talked about, toxins damage our cells. They increase that inflammation and that immune system working together. The area we're going to talk about a lot tonight is about insulin resistance. Insulin resistance starts in that diabetes risk with Alzheimer's, starts to increase that inflammation, and insulin does affect us being able to clear that amyloid from our brain. We also talked about trophic factors or growth factors. The brain needs to constantly keep evolving and changing and developing and stuff, so we need to have growth factors for that brain. And we'll talk about a couple key growth factors later on. And then structural. The brain can be damaged, from lack of blood supply, from getting hit on the head, from other structural kind of issues that can go on with it. But we'll kind of address some of those. So kind of going through is we want to, with Alzheimer's or brain issues, we kind of want to think about the brain as kind of a symphony, and all the supporting to the brain is a symphony. We don't treat one instrument as a symphony. We treat the whole symphony and stuff. So we work with the woodwinds, we work with the brass, we work with every single area so we get that nice sound. So that's how we kind of want to think about this. Dale Bredesen has found with his research that there's 36 contributing factors to Alzheimer's. That's why a drug hasn't worked, because a drug only kind of tries to target one area. So we need a drug for it to work. We need to target all 36 areas, which could take some time. We found some ways that we can do it instead. And so we really want to, with that, is start addressing those contributing factors. So he kind of says it's kind of like a roof with 36 holes in it. And, you know, if you start patching up the roof, if you patch one, you're still going to get leaking. But if you patch enough holes enough, you might be able to kind of create some changes and stuff. So his Recode program works at addressing these 36 factors. So I just kind of actually, and I should put this on the other slide and stuff. So we talked about amyloid a little bit. So amyloid occurs in the brain, and you know, depending on what we're exposed to can turn amyloid either into a healthy substance or into something toxic. Amyloid, how it works and stuff is it binds to things that it doesn't like. So if you're inflamed, amyloid will bind. If you've got toxins like heavy metals, amyloid will bind to it. If you've got too much sugar, amyloid will bind to it. So amyloid's that's that kind of protective thing, but there's too much of it around. So we have to kind of come to not trying to get rid of necessarily the amyloid, but the causes that are the reason why amyloid's kind of coming around. So we're kind of go on to the types of Alzheimer's that Dale Bredesen talks about. And I think even though we're talking about the types that he has come up with, we still have to think about it as these are the areas that we can address that we don't get to this point. Has anybody ever heard of someone being cured of Alzheimer's? You know, we don't hear it and stuff. So that's why we're here tonight, is because there is a cure, but we have to start thinking about prevention and stuff, because it's not in our wheelhouse yet. You know, we think about diabetes being controlled, cancer, we can control it. Alzheimer's, we're not there yet. So that's where we've got to change how we think about this condition and the health of our brains. So Dale Bredesen came out, and he basically kind of came up with 6 different types of Alzheimer's diseases, but it's brain impairments that we should really think about it. Type 1 is called HOT, and this is his terminology, not mine. So the type of people who have this sort of brain inflammation going on, they have just not in their brain, but they got it going through their whole bodies. These people lose the ability to store new information, and it actually affects the loss of the hippocampal volume, which is where we store our memories. So as we sort of talked about genetics, there is a gene, ApoE. There's a marker, you'll hear ApoE4 and stuff. ApoE4 does increase your risk of Alzheimer's. So there's the 2 genes, ApoE34 and ApoE44. So ApoE34 increases your risk of Alzheimer's by 30%. ApoE44 increases your risk by 50%, and also causes the Alzheimer's to occur about a decade earlier. So we can actually see people into their early 40s and 50s even starting to have true diagnostic impairments and even being diagnosed with Alzheimer's, which is very, very scary. However, as Dr. Tetlow said, your genes are not your destiny, okay? You may have been given them by your parents. It's your environment that turns these genes on, and that's our job, is to turn these genes off and not have them create damage to us. Another statistic about this ApoE4, Caucasian women have a 60 to 68% increased risk of developing Alzheimer's by the age of 85 if they have the ApoE44. So that's a really high number and stuff. And remember, a lot of our women, as we get older and stuff, women live a little bit longer than men, although it's changing a bit, they're the caregivers. So now they're taking care of the families and everything else, and now they're having cognitive impairment as well too. ApoE4 also shuts down a longevity pathway. It's called SIRT1 gene, and that gene's really important for aging and stuff. And there's been a lot of talk about, everyone heard about resveratrol, you know, the stuff in red wine grapes. So that helps open this longevity pathway. If you have the ApoE4, that's something we say, oh, we need to really keep that pathway opening really well. So we can encourage people to have resveratrol-based stuff in their diets. That's where the red wine and the dark grape juice and stuff come in. The second type of Alzheimer's that Dr. Bredesen talks about is type 2 cold. So this is loss of growth support. And so this is loss of hormones. And we kind of see this in stuff. As women sort of go through menopause, like, I'm not as sharp as I used to be. I'm a little more foggy. Thyroid people, when, their thyroid, when they have an underactive thyroid, go, I'm just foggy. I'm just kind of, I just can't think. And everything's kind of dull. When people have adrenal issues, and we've done our adrenal talk as well, people, same thing. I'm just tired all the time. My brain feels like jello. I can't think. And so that's loss of these hormones that are so important for the brain. So the sex hormones ones that we look at are pregnenolone, progesterone, estrogen, and testosterone. And pregnenolone's kind of like the master one, and then it sort of falls down and it creates a little progesterone and a cortisol and some estrogens and testosterone. So we kind of look at pregnenolone for brain health because it's kind of important because it's neuroprotective. It actually helps to protect the brain. But when people are highly stressed, that pregnenolone, actually we call it pregnenolone stealing, pregnenolone comes down and starts making cortisol. So stress plays a big role in this and trying to control our life stressors and get that balance. So pregnenolone is one area that we look at. Same thing with estrogen and progesterone. As women go through menopause, their progesterone levels drop and their estrogen levels tend to stay high. So that imbalance there can create some problems with the brain. As well, too much estrogen can create a little more inflammatory markers, which also affect the brain. And testosterone, too. Testosterone, and I've been doing hormone replacement for a while, and everybody who has good testosterone, or if we replace their testosterone, number one thing they say to me is not they're changing their libido, and we'll talk about it actually next month in our sex hormones, too, is they say, I feel really mentally clear. I feel sharp. And so I think we have to really look at it as testosterone in both men and women and find that sweet spot that just helps that memory, because testosterone is a growth hormone as well, too. Adrenal hormones. So we do in our office, we do look a lot at adrenal markers. We can look at them in blood. We can look at them in saliva. We need to support our adrenal glands. We're quite stressed people, and we need to, as we're working on our mind-body practices and figuring out what our stressors are, support our adrenal glands. So good, healthy diets, stable blood sugar. When you have adrenal issues and if your blood sugar starts dropping and stuff, what happens is the brain goes, we're under stress, and starts raising that cortisol. Cortisol is inflammatory, so that blood sugar stability is really important for people who have a lot of adrenal issues. I said thyroid before. Thyroid's important for metabolism. Thyroid's our temperature switch in our body. And our body's just a bunch of chemical reactions. And if that thyroid is a little underactive, our temperature's a little lower, all those chemical reactions don't occur efficiently. So thyroid support we have to look at. And thyroids need a lot of nutritional support. So, and we also talked about MTHFR. MTHFR and stuff, if you have that gene, we need to look at more nutritional support, whether it be supplementation or diet and stuff, so that we can keep giving these growth hormones for the brain to help keep the brain developing. The next type of Alzheimer's that we talk about is sweet. And so this is kind of a combination of 1 and 2. And the reason why there's a sticky bun up there is that's called glycation. It's not good and stuff. When you get glycation, ever heard of a hemoglobin A1C? There's a blood test. That's basically what they're looking at. Is they're looking at the sugar glycating onto the red blood cell. And if you have too much glycation, your red blood, we notice in a red blood cell, and your hemoglobin A1C goes up. So that's called glycation. We don't want glycation. It's highly inflammatory. It makes our red blood cells really stiff. It creates a sticky bun out of our body. And we, even though we love eating them, we don't want our bodies to be sticky buns and stuff. We don't want that hard sugar, you get stuck in your teeth and stuff. We don't want that in our bodies. And so this type here has a lot of insulin resistance and blood sugar instability. Insulin, everyone hears about insulin all the time, and everyone thinks insulin's bad. Insulin's actually good for us. It helps us grow. It helps us create new muscles and nerves and bone growth. And so we need insulin. It's a growth hormone. We need it for when we get sugar coming along the bloodstream. The insulin goes, all right, let's take that sugar and put it into the cell so the cell can use it. Unfortunately, we eat too much sugar, and then our cells don't use it immediately and store it, and then we store it as fat. So we need insulin, but if we're putting too much sugar in the system all the time, insulin's going, okay, put in the cell. It can't do its other jobs. And so we need to kind of keep addressing that sugar balance and making sure we're not dumping up too much insulin all the time. The pancreas, besides insulin, also produces an enzyme called insulin-degrading enzyme. So it breaks down insulin. So once basically sugars come through, there's insulin, this enzyme comes up and goes, okay, insulin, you're done your job. If we have too much sugar all around all the time, this insulin-degrading enzyme is always trying to put the insulin away. Okay, insulin, you did your job. Insulin-degrading enzyme does something else really cool in the body. It breaks down amyloid. But if we have too much insulin dealing with the sugar around in our body, it can't break down the amyloid. So this enzyme is really important. That's why we want to lower down that sugar in our diet, keep our blood sugar stable so we don't have so much insulin hanging around so that that enzyme can do more job up in our brain. And the other thing also about too much sugar in our diet and stuff is it creates inflammatory markers, and those inflammatory markers are widespread and can cause damage to the brain and to the rest of the body. One area and stuff that this is sort of newer to people is that brain issues, cognitive issues can come from toxins, and this is kind of the new big hot area and stuff. We live in a toxic environment. I'd love to say we don't and our bodies can handle it, but we live in a huge toxic environment. This type of cognitive impairment affects the whole brain, so it's not one part of the brain. People who have toxic type of brain issues, we see it early on. They can't organize, they can't plan, calculation issues, they can't find words. What was that again? Sometimes they get diagnosed with attention deficit disorder as an adult, but never had any issues as a kid. Sometimes we get depression, and they're thinking, a lot of depression now may be coming from toxins in our world and our body's inability to get rid of these toxins. Stress plays a big role with this type of toxic cognitive impairment. And so it's kind of challenging. It's a challenge for us that we love to try and find out what is the toxin and then how are we going to get rid of it out of you. So some of the toxins are heavy metals, mercury from fish. We've all heard that before. That's why everyone know what smash fish are? Everyone know smash? Salmon, mackerel, anchovies, sardines, and herring. Those are the fish you eat. That's it. Okay. Everything else is high mercury and stuff. So the smash fish are the ones that are the good for us. You have to learn to love them too. Smash. So salmon, mackerel, anchovies, sardines, and herring. So I know they're the smaller fish. The smaller fish don't tend to get as much mercury. The big fish, they pick up the mercury because they eat the smaller fish. It's the food chain thing. So mercury is a big key. The other thing is dental amalgams. Dental amalgams do break down. They do cause problems, and we do get mercury overload. And it's not quick mercury overload. It's slow. Mercury gets dissolved in the body, and it goes right into the bones. And so sometimes we don't see mercury toxicity, especially in women and men, as they start hitting that sort of the andropause or menopausal age when bones start to really break down, and now all these heavy metals are being released from the bones that have been stored there for years. So that's something we definitely, you're hitting menopause. It's your brain issues. That's just because you're hitting menopause. Well, what if it's because you're now losing hormones and your bones are breaking down and now you're releasing heavy metals into your body and you haven't had the best diet in your life? Oh, wow. Can we start having some cognitive issues? So those are things we can really start to address instead of just saying, poo-poo, I know you always lose your keys and stuff, but no, we need to start really taking a look at this. Another heavy metal is lead. We've heard about lead in paint and in dust and stuff. Cadmium is a very common heavy metal. Cigarette smoking, chemical factories, paint is another common area. Arsenic is a new big one that's coming up. Arsenic is in groundwater. So we're seeing it, you'll hear a lot about it in rice, especially rice that comes from an area that has very poor groundwater. We'll see higher levels of arsenic. And also in non-organic chicken. They're allowed to give arsenic to chicken as an antimicrobial. So we get the arsenic in our diet and stuff. So that's why it's important from a chicken standpoint, and all our animal sources, is to definitely do organic. The other area and stuff that one of our lectures that we love to go see, Bob Roundtree, who will scare us all about toxins, is arsenic's really high in pressure-treated wood. And he showed at one of our lectures and stuff, this family that built a deck, and this little kid with pressure-treated wood, and they had two little kids and stuff, and they let them play on the deck, crawling all over it, hands in their mouth and stuff. The whole family got sick. Very, very sick. And it was from pressure-treated wood. So they use arsenic to pressure-treat wood. So those are just some things we sometimes have to kind of be a little bit aware of as well. Copper is another heavy metal. Copper is found, copper pipes. We have copper in our supplements. Copper is not always so bad, but there's a really important zinc to copper ratio. We need more zinc to copper. If we have too much copper, it's very inflammatory in the body, and it tends to get dispersed into soft tissues like the brain and the lungs. And we kind of want to offset that copper deposition transition by upping our zinc levels.
And I would also share that zinc copper ratio is really important for the gene level as well.
Yeah.
So when you think about genes and what's happening in the background, there's a lot of pathways.
Yeah.
Annmarie loves to see the pathways. She likes to see the cycling and how all the pathways and circles are affecting.
Yeah.
So if you have a zinc and copper ratio that's off, you're also affecting, it's the cofactors that turn on and turn off the pathways. You need a little zinc to get to the next step, you need a little copper to get to the next step. So when you're off, you're going to be affecting the way the genes are cycling, the way the enzymes go from one molecule to the next. That's a cycle. That's basically the way the gene is expressing. A gene is coding for an enzyme. That's a pathway, little enzymatic steps. Zinc and copper being off will actually affect the way that your genes express, and that's a great way to get back in balance.
Yes. And that zinc is so important for hormone function, and it's also really important for insulin as well too. And so we want to make sure those heavier metals and stuff are in balance. Molds. Molds are sort of a big new trending area and stuff. 25% of the homes in the U.S. have mold. However, does it mean we all get sick from mold? No. You actually have to have the genetic susceptibility for mold. And it's an HLA marker that we can do on a blood test. So if you have that marker, you have a high risk of, if you're in a moldy environment, of getting sick. So it's something kind of cool to know. We sort of, through our clients, are sort of finding out the back way. They've been exposed to mold, and then we test and go, yeah, you kind of had that gene, I'm sorry. So those people, if they have that gene, we really want to make sure that they are checking their homes, they're using their dehumidifiers, watching where they're traveling and stuff. That HLA gene as well also puts you at susceptibility of getting sick from Lyme disease as well too. So it's another marker in the Recode program with Dale Bredesen, and we also do it in our practice all the time, is checking this HLA marker and seeing do you have some genetic risk. Lyme is very endemic to this area. We kind of think a majority of people have had exposure to Lyme, but how come? Same thing. Some people get sick, some people don't. You need to have that genetics, but you also need to have that really healthy immune system to basically damper down. If we get an infection, let's put that infection down. It can come back to you again, sort of reactivate itself, and usually it's because your immune system has kind of gone a little haywire and stuff. Lyme affects the brain. People who have had Lyme disease will say, yep, brain issues, can't think, can't concentrate. So we're starting to see, we want to make sure we're assessing for those heavy metals, but it's not just Lyme. There's also a bunch of co-infections as well that goes along with Lyme. Medications are another area that can be toxic to the brain. Everything from, and we've all heard in the news now and stuff, Valium, benzodiazepines and stuff, especially as we get older, are more damaging to the brain. Statins are damaging to the brain. Antihistamines, especially long-term use of them. Proton pump inhibitors and stuff also affect that stomach acid and absorbing some key nutrients that we need for nerve function. So we got to be very careful about those. Tylenol, ibuprofen, especially long-term use. There are some blood pressure medications that can also affect the brain, and alcohol too. So it's not that we're saying, no medications, medications are bad. It's like, no, we need to use them appropriately and make sure that if you need them long-term, that we are looking at the systems that they could possibly be affecting. Another key area and stuff that can cause toxic damage to the brain is chronic infections. We see it quite often, a lot of chronic infections in the gut, in the teeth, in the mouth and stuff. The gingivalis, you ever heard of gingivitis? It comes from a bacteria called gingivalis. It actually has been seen in the brains of Alzheimer patients. So key thing we start doing, flossing your teeth. Really important. Get to your dentist twice a year. Get your cleanings done. We want to lower that risk of having that gingivitis, that bacteria in our mouth. There's even now some probiotics that really target balancing out the microbiome or the healthy lining of inside the mouth, and the sinuses too. Sinuses are another key area. People who have chronic sinus infections and stuff can actually start colonizing. There's a condition called Macron's and stuff, which is a chronic staph infection up their nose, and that can actually go to the brain and can cause brain damage and stuff. So chronic sinus stuff, we want to look. Do you have funguses? Do you have molds? Do you have yeast? And treating the sinuses just like we would treat the gut, just like we would treat the mouth. It's an exposure to the outside environment, and we want to make sure that exposure and stuff doesn't have any things that aren't supposed to be there. Another key area and stuff for if we start having this toxic brain overload is making sure that a person's able to detox well. Are you going to the bathroom every day? So if you're that, menopausal woman and you're leaking out all this heavy metals and you're constipated, what's happening? Your bowels are just going to keep holding on to heavy metal and creating more toxic, more inflammation in your body. So healthy bowel movements are a key in our practice. We're talking about it all the time. Livers tend to get quite congested, and I always kind of describe the liver as the blue route. We want to go on the blue route and we want to fly down the blue route. We don't want to be stuck in traffic. We don't want there to be an accident, everybody looking at the accident. But your liver is a huge area for detoxification. So we really look at markers and stuff that show good liver health. And a lot of liver support is done diet-wise and stuff. Eating a lot of really, dark green veggies and drinking some teas out there is really healthy for the liver. Kidneys, urinary. We just make sure people drinking water. We're not just drinking, or dehydrating ourselves all the time, or drinking too much caffeine or alcohol, or taking too much ibuprofen. We want to have good, healthy kidneys and stuff because that's another detox system. Our lungs, we want to make sure that we are moving and breathing and doing our centering and taking that breath through the day because that helps us detoxify. And then our skin is another area of detoxification as well. So skin, people always tend to forget about the skin. So lymphatic drainage through our skin. So dry brushing our skin, getting massages is important to help kind of with detoxification. Ways that we can detox and stuff. Has anyone ever heard of hot cold therapies or knife therapy? So there was this, it was like 1800s, there was a Bavarian priest and stuff called Knipe, and he basically said body needs to go through hot and cold and it helps to detox, and it does. So little tricks we can do at home is just when you're in the shower and it's nice and warm, drop it to cold for like 20 seconds and then put it back to warm and keep it there for a minute or two and then drop it to cold and stuff. That actually helps to detoxify. But what it also does too is, remember those little mitochondria I said for the brain, those little energy cells? It actually makes them work harder. It's kind of like exercise for them. They're like, ooh, we got cold. Let's work a little harder and stuff. So there's little tricks we can do. And I think that's why there's that new cryo sauna that you go in and you get sprayed with those, like, that's a little aggressive, I think. But that's the same kind of concept, is that we want that heat and cold, that expansion, that stress on the body. And then the body responds in a good, healthy way. So that's something we can do. And getting ourselves moving are really important. Infrared saunas, another way our bodies can detox some of these toxins that we have. Not sort of the hot, sweaty saunas, but the infrared ones. I trained as a physical therapist a long time ago, and we trained with these infrared like light things and stuff, and you would put them on a joint and stuff, and I always was like, how is that supposed to help a joint? But it actually does. The infrared light actually gets right down to the cellular level and helps that cell detox and stuff. So infrared saunas are something that we can start using. Like I said, exercise, doing Epsom salt baths and stuff are really important. And then nutritionally, we talk about a lot of things we can do from a detox perspective. All right, so the last time, I'm not really going to go through these, that how we can get brain damage and stuff, is Dale Bredesen calls the pale type, so getting lack of blood flow to the brain. So we want to make sure, we've got good artery walls and nice open vessels. We want to make sure our blood pressure's in control. I used to work with a lot of geriatrics and stuff, and I always got nervous when, my blood pressure's great, and I'm looking at these, tiny little frail little ladies and their blood pressure's 100 over like 50. I'm like, oh boy, when they stand up too fast, we could also have a fall because we're not getting that blood flow to the brain. So I think there's a sweet spot of, as we get older, of where we need our blood pressure to be. And when we need that blood flow to the brain, it helps us think better and stuff. Dazed, and we all know, we've all heard enough in the news about sports and trauma and CTE and chronic traumatic encephalopathy, or damage to the brain. There is even talk and stuff, one fall in your life and hit your head, you can create, brain damage that can be permanent. So I think we really need to be aware of those car accidents, the slips and falls, kids in sports and stuff. If you do get a concussion, within 24 hours of getting a concussion, you actually get a leaky gut at the same time. And then, leaky gut. Now we start getting some inflammatory markers going on. Now I'm going to start eating gluten. Now I'm going to get more inflammatory markers. That's going to affect my brain. So you can get this cycling of this inflammatory process going on. So I think we need to be very careful about, if we get our head banged hard enough and they are saying, you got a concussion, we need to really treat it appropriately and make sure we're doing the right therapies and stuff for it. And there's some great programs out there, some great therapists and doctors who work with some, with even mild brain issues from trauma. So let's get to the fun stuff. So I'm just going to take a sip of water here. you guys came here to talk about what can we do. So we're going to talk about lifestyle. How are we doing on time? Okay, we're good on time. All right. So how we talked about, all right, Alzheimer's, cognitive impairment. How can I help right now? What can I do today? And I think we really need to think about this is because we said Alzheimer's is a scary disease. It's an expensive disease, but it's also like a scary disease in the sense that I don't want to lose the ability to forget my child's birth or to forget my grandchild's name. Or I don't want to have the ability of stopping work at age 60 because I can't do my job. So I think we really need to now step back and say, yeah, that's a disease for old people. You know, when I'm 85, I have that risk there. No, we have the risk now. And I think we really need to kind of say, I got to start doing little things now. It doesn't mean we need to change our whole life immediately. But I think we need to start saying, hey, maybe I need to do this, or maybe I need to do that, or maybe I need to get checked for this because I am having things that when I was younger weren't there. And it shouldn't be just an age thing. I think we tend to say, oh, well, it's just an aging thing. And I don't think so. As a physical therapist, I'm going to tell you a story through my favorite patients as a physical therapist. I used to do, like I said, I work with athletes and I've worked with, you know, the general population, but I love my geriatrics. They were my favorite patients because they were just hilarious. My three favorite patients, my 99-year-old who at 100 called me and said, hey, Annmarie, I bought myself a brand new car. Bought herself a brand new red Hyundai at 100 years old and was still driving. Coolest lady. She lived to 104, so she got some use out of this car. But she was so sharp as a tack. And I'm like, how did she do that? She used to play for the Boston Symphony Pops, and she played the violin and continued to play the violin in her 99th, 100th year and stuff. She kept her brain really active. My 97-year-old, I used to live in Las Vegas, would go to the casino and play Mahjong, and then she had her card groups, and she would day trade in her mid-90s. And so I would just sit there and go, your day trading isn't the most stressful thing. She's like, what do I care? You know, it's just money, you know, at my age, what do I care? But just sharp as a tack. I'm like, day trading is such a stressful thing. And she was on it all the time. I had a 99-year-old taking care of her 101-year-old husband, still driving. And same thing, they had a lot of support, family, community and stuff, but they kept their brains engaged. They did not, and then I've had patients who are 40 and 50, completely debilitated, watching TV all day, eating a high fatty diet, not moving and stuff, and their brains were just mush. Like they just weren't there. And so I'm like, I've seen these patients that are people that are like 99, 100, wait, wow, and cognitively so there. And so I think we really need to think about what are we doing early on in our life? And I don't think it's all just perfect genes. I think it's what are we doing in our environment to fix those, to really affect those genes. So this is where I kind of want to kind of dig in. I want you to really think about in your life, what can I start now to making changes? And it's not like we can do, let's take this half of the group and you guys do nothing and this half do something. And let's see in 20 years who has cognitive impairment. We don't want to do that. And we never will know and stuff. But we, you know, if we start getting those age and we're still sharp and stuff, we're going to be so happy with ourselves because we're going to remember those moments in our lives that are so key, and we're not going to be like, oh, what was your name again, and when was your birthday, and those scary things and stuff too, or forgetting how to get someplace. So we talk about it in functional medicine: antecedents, triggers, and mediators. So antecedents are your genes; they're kind of what you've been given. Triggers, things that happen in your life that just start the ball rolling. Sometimes we can't prevent those triggers, but mediators are things in our life that we can change right now to control our lifestyle and control what's sort of going on. So treatment's a little different for everybody, but it simply goes like this. We fix the underlying causes, the infections, the toxins, and the chronic inflammation. And then we kind of bring in those neurotrophic factors, those good growth hormones. We use diet, lifestyle things to kind of challenge that insulin sensitivity and get that blood sugar under control. And our hormones and herbs and stuff, we also want to make sure that we're looking at addressing as well too. So one of the biggie areas for brain health is sleep. And there's a reason why there's a baby up here and stuff too. Besides, it's so adorable. There is. So I don't think we sleep well enough. There was a study done last year and stuff. They took people who had chronic insomnia on heavy-duty medications. They took them up to a cabin, northern Canada, no electricity. These people were sleeping perfect within a week, absolutely perfect. And they just got them on this regular sleep-wake cycle. You got up with the sun, you go down at night. They weren't allowed to let any electronics. They just got their bodies into that rhythm again. And Rituals for sleep are important. Babies don't come out of the womb learning how to sleep. We train them. We create a ritual with babies. We rock them. We give them their baths. We don't sit them in front of a TV and stimulate them and expect them to sleep. We have to kind of think about as adults, well, I just want to watch that last Netflix episode, or there's that leftover chocolate cake in the fridge, and I just need to do one more cleaning thing, or where's my grocery list for tomorrow, or get my notes prepped for the next day. Just a joke about that. I tried to do mine earlier. But we have to kind of stop and say, all right, where's my ritual? It's such and such time, electronics shut off. That blue light that we have on our computers and our phones and everything else keeps a part of the brain on. It's called the reticulating activating system. It keeps that brain just going. Even a flash of your phone, sending a message in the middle of the night turns that brain back on again. We need to shut those brains down. So no electronics, at least a half an hour before bed. No TV in bed. I have a TV in my bedroom. I yell at my husband all the time and stuff like that. But we have a thing, TV's off and stuff, because we have to shut that TV off. I have some people like, but I need to listen to it and stuff. I'm like, okay, if you need the TV in the room, put a blackout towel over top of it. Listen to the music, or listen to the show that you're on. You've heard the show before anyway, so you know what's going to happen anyways. If you think back, generation or even 2 generations ago, what did they do before bed? They listened to the radio. I think my dad still listens to hockey games at nighttime, but you don't need that visual stimulation. You can have some auditory stuff. You have the brain kind of, instead of listening to things. Jazz music has been shown to help with sleep because it's always a changing rhythm. So the brain sort of goes, it doesn't go like there's that same rhythm and then it starts drifting off. So it makes it very mindful. So you can use music before sleep. Make sure your body's tired before you go to bed. And it's not, we're tired brain-wise. We've had busy days, our brains are tired. But is your body tired? Did you move all day or did you sit in a chair? So sometimes we need to get up and do that walk sometime in the day. We need that tired body. Tired bodies, better sleep. Cooler rooms are important. Our bodies sleep better cooler. However, feet, hands, and head should be warm and stuff. So I'm not saying we have to wear the hats, but sometimes if people have sleep issues, we say make sure you get something on, the feet and on the hands and stuff, but have the room cool. And that dark room. Now, the reason why I put the picture of the baby here, we've talked about lymphatic system. Everyone knows lymph system in our body is a bunch of channels throughout our whole body that helps to carry nutrients to the cell, bring infection-fighting little cells and stuff to our bodies. So when you get a cold, my lymph node's really swollen and stuff like that. It's trying to bring infection-fighting things to get rid of that cold. Our brain has a lymphatic system to it. It's called the glymphatic system. The glymphatic system helps to drain out, guess what? Toxins and amyloids and inflammatory markers and sugars and stuff from the brain. Cool thing, if you sleep with your head up, the glymphatic system doesn't work. You need to sleep with your head flat or your head down a little bit. Now, as a physical therapist, I've always been a big pillow person and stuff, but I think I have to rethink some of my thoughts on that. Is like, if we're sleeping properly and we just have a little bit of a pillow, that's that head down position. It actually helps to drain out the lymphatic system. And everyone goes, well, wouldn't it make sense if your head was up that would drain better? No, they've actually looked at it. It's your head down a little bit. So sleeping with an arm or just a little bit of a pillow with your head flat like the babies is actually really good. Now we have to watch our necks. I don't want anyone to get, strained necks and start getting inflamed, but it may be something we want to work on. Maybe I do have too many pillows, or I was watching TV with my head up, but I sort of fell asleep. Maybe we need to turn the TV off and start working on our pillow positioning. And it is also side lying too. Side lying with your head neutral or a little bit down actually helps to drain that lymphatic system from the brain. And then the longer sleep. Our goal is 7 hours. There's so many things linked to 7 hours of sleep: weight loss, inflammatory markers, better blood sugar control, decreased risk of diabetes. But it gives our brains time to clear up, to clean out the junk and stuff. It gives the rest of our bodies time to kind of get rid of the junk too. So that 7 hours is kind of a magical number. People go, but I don't have enough time in the day. I'm like, if you get a good sleep, you'll wake up in the morning and you get more done in your day because you had a better sleep at night. So that's kind of, I tell people, let's have you try and target for that. Food plan. So food plan for brains. There's a lot of food plans, and we at the practice don't really believe in one specific food plan. It is very individual. It's very targeted food plans. There is a lot of data about that the ketogenic or the mitochondria, that's why it's called mito, food plan is very health promoting for the brain. But I want to take a step back for a second. It's really simple. Get rid of the junk out of your diet. More than anything else, eat more vegetables. That's really a lot of what our diet changes need to be. You don't need to follow this, I'm checking my ketones and I'm in ketosis and I'm gluten and dairy free. Just sometimes the simplest things you need just to start with. So the ketogenic Mito food plans, ketogenic is a very specific diet that was originally designed for kids who are having epilepsy and having chronic seizures, and they put them on a very high-fat diet, and their seizures got better. And they go, wow, it's great for the brain. David Perlmutter, he does the Brain book and stuff. He believes a lot of the keto diet, and I like the keto diet, and I've done the keto diet, and I like it and stuff. But I think we have to be careful with it a little bit too, and we have to be careful when in our life we use it. Ketogenic diets, there's intermittent fasting that's done. You need to eat lots of vegetables. You need to eat those healthy fats. The one thing about the ketogenic diet, if you have blood sugar instability, if you're a diabetic, if you're breastfeeding, if you're pregnant, it's not the diet for you. And so I think we also have to look at what other health issues are going on before we really target this type of diet. But in an essence, it is high nutrient dense foods, low in those refined carbs, healthy fats, MCT oil, which is called medium chain triglyceride oil, olive oil, but only olive oil raw. Do not cook with olive oil. It breaks down the bonds in olive oil and creates a very toxic substance. So olive oil raw on foods, like after you've steamed your vegetables, put some olive oil on top. And avocado oil is good as well. Avocado oil and ghee are okay to cook with. There's new data coming out, but coconut oil may not be so great to cook with. It may also be it has a lower heat index and may be causing some bond breakdowns as well. So if we can cook low and slow, but that takes time, then you could use like a coconut oil or even an olive oil if you were going really slow and low. But most of the time we cook a little higher and faster because we want to get it done quickly. So avocado oil and ghee are okay ones. Fiber is really important. Fiber is great is for stabilizing that blood sugar, for a healthy microbiome and a healthy gut. We don't get enough fiber in our diet. It controls those blood sugar swings. 8 to 12 servings of vegetables today. And the people who see me here know I say this all the time. Everyone goes, oh yeah, I eat enough vegetables. I go, really? Prove it to me. Show me that you can eat 8 to 12 servings of vegetables a day. Get vegetables in for breakfast, vegetables in for lunch, vegetables in for dinner. And you'll see it's challenging. But if you just work on that, it makes a huge piece of the plan out. So I would say just really focus a lot on that. Probiotic, prebiotic rich foods are important for gut. However, there is, we have to be careful. Some people have gut issues because some probiotics sometimes can cause more bloating and gas. So we have to kind of time it properly. But there's foods out there, kimchi, yogurt, sauerkraut, are great foods for our gut health. Protein, the big thing with protein, everyone's like, oh, the paleo and stuff. And I'm like, I'm not against protein. I think we need to eat protein. But if you eat too much protein, it converts to a carbohydrate. It will throw your blood sugars off. So those heavy-duty protein people that I'm eating protein, you're just causing more blood sugar instabilities. So it is about 0.8 to 1 gram per kilogram of your body weight a day, and then you can split that into however you do your meals and stuff. And that's really all you really need. Protein sources should be organic. They should be grass-fed. They should be free range. There's a lot of things in foods, in our animal products and stuff that we really want to stay away from the toxins. And we say limiting gluten and dairy. Some people we have to with certain conditions. Some people we just sort of say, all right, let's have you try it, see how you feel. But remember, gluten's in a lot of carbohydrate like processed foods. I think we all believe in a little bit of grains, good healthy grains. Oh, they might have gluten in, but healthier grains and certain dairies. So, if you're making your own homemade yogurt, and you can tolerate it well, fine. So we said that's why I work with, Rachel, our dietitian, and other practitioners to figure out what's the right diet for you. All right, so everyone wants to know about intermittent fasting. This is the new hot topic right now. So what's intermittent fasting? It's fasting. Yep, everybody kind of, all right, I'll just have a couple slides, we're good. So intermittent fasting and stuff. Why intermittent fasting for brain health is so cool is it actually increases a growth hormone for the brain called the brain-derived neurotropic factor, BDNF. So BDNF increases and it helps to grow that brain really healthy through fasting and stuff. 12 hours is kind of where we're just starting at. And I'm like, 12 hours is doable. Don't eat it late at night. Finish your dinner. Your body needs about 4 hours to digest and 8 hours to detox and stuff. and don't eat for 12 hours later. I think that's just a very simple thing to do. The people who have the gene, the ApoE4, we may push their fasting times up to 14 or 16-hour fasts and stuff. There are longer fasts out there. You have to have a great diet, like we sort of just talked about, lots of veggies, high fiber in your diet, healthy protein sources, and then we could go a little longer with the fasting. There is some data that if you fast for 36 hours, you could increase this brain-derived neurotrophic factor by 400%. 36 hours, I think, is pretty extreme. I don't recommend it, but it can be done, and in a lab they do it. But I think we could work up to some people up to 16 hours. There is possibly some people 18 hours. Not every day, though. It might be only 2 or 3 days a week, especially if we're thinking we want to support that brain health a little bit more. But you do need to have some support if you're going to decide to fast. I wouldn't just go and I'm just going to start fasting 16 or 18 hours and stuff. There's ways to do it, and you can add some fluids into your diet. It's not just I'm not having anything to eat or drink at all and stuff. But I think 12 hours is logical. It just means that, all right, eat dinner, stop, don't eat till the next morning, don't late night snack. Exercise increases brain-derived neurotrophic factor. So if we're doing, a good healthy diet, we're doing a little 12-hour fast, and I'm exercising, wow, am I supporting my brain? So there's some really simple things we can start to do. We all know that exercise increases vessel formation. It increases the size of that hippocampus that we said that sometimes in that type 1 Alzheimer's gets shrunken a little bit. Lowers the effects of stress, helps mood, helps sleep. Now, the other thing I used to do as a PT and stuff is in my little geriatric people, I would actually play little brain games with them. So when you're doing things like your balance exercises, or, if we're doing planks, or if you're doing squats and stuff, I would do little tricks. So we would be doing squats, and I'd say, all right, tell me the days of the week backwards. And so they'd be squatting, they'd like Sunday, Saturday, Friday, Thursday. And so you could play little brain games. So if you're a person who likes to plank, do your phone number backwards. Do your spouse's birthday backwards. Do the alphabet backwards. Start doing little brain games while you're exercising at the same time. What a difference it makes. And I started playing with that for a few years. And my people who did it with their balance exercise, we did a little more brain activity, they had better balance when I retested them, and better balance faster and stuff too. So I think we can kind of play with that. So any personal trainers in here who want to work on kind of developing a brain game cardio training program and stuff. So stress management, we've kind of talked about, biggest thing is identify your stressors in your life and start doing something to help you either control those stressors or manage them. Important to breathe in your day. Listen to music. There's neural agility programs out there. Go for a walk outside. Art therapy, and get your social supports. Make sure you have a community of people who can support you. If your brain's starting to change a little bit, make sure you talk to people about it. Say, hey, this is going on. I need some help. One thing with the Recode program with Dr. Bredesen's is we do need to have a caregiver to support our clients and stuff so that they can have that social support and then assistance making some of these lifestyle changes. And the last little thing is, brain games. Like I told about some of my clients, my PT clients and stuff, engage the brain. You used to play a musical instrument, why can't you play it again? Card games, board games, puzzles, Sudoku. There is some apps, Lumosity and Elevate. They have actually studied some of these and said, does this improve the brain? The only one that really got some good data behind it is Brain HQ. That one actually got some good data, but it actually helped people actually change with memory changes and stuff. But there's a lot of things out there. I think do what you like and challenge your brain. Don't come home and sit and go, there's the TV, and then the brain just shuts off. Do something that's very engaging for the brain. And last little thing, I'm not going to go into much into supplements. There's a lot of things to do. I say work with a practitioner to get your levels checked so you know where you need that targeted support. We said certain gene expression needs certain supplements. Magnesium is needed for the brain, and we have a worldwide deficiency in magnesium, so it's something we tend to kind of promote quite a bit. Selenium's using for thyroid function. It helps with glutathione to help as a detoxifier. It's our greatest antioxidant in our body. D and K2, vitamin D, it works as an immune system regulator. That's why we encourage it when people are starting to get sick to take more vitamin D. Vitamin E, B1 is important for memory. B6, B12, and folate important for that MTHFR marker and watching your homocysteine levels. And vitamin C is important for adrenals. Fish oils are important for inflammation. Some of the ones on your right-hand side, acetylcholine helps with that synapse or that connection between each nerves. Acetyl L-carnitine is a nerve growth factor. CoQ10 is important. As we get older, we lower our CoQ10 in our body. If you're on a statin, you really lower it down. And CoQ10 helps those little mitochondria. PQQ and stuff is something that helps as well, mitochondria. Whole coffee fruit extract is not coffee, it's the whole coffee fruit extract. Actually does increase BDNF, that brain-derived neurotropic factor. However, there's some data coming out, but we shouldn't take it long-term, maybe 3 months or 6 months. It's not a long-term supplement. Bacopa is also used for neurotransmitter function. GO2 helps with focus. Lion's mane is a nerve growth factor. And Trifle also helps with decreasing inflammation and gut function. So those are just some things that actually, there's way more. There's way more that we can use. And sometimes there's combo products that have some stuff in it. This is the one that actually Dr. Bredesen, he's used these a lot in his program. But we also recommend a bunch more. I just wanted to kind of highlight a few of them. So kind of in summary and stuff, many things affect the brain and stuff. You know, you kind of have to pick what area do I want to start to address. And remember, it's going to take, you know, in Dale Bredesen's program, it's going to take 3 to 6 months before you notice a change. It's not going to be instant with that brain change that, oh, yeah, I am sharper. Oh, I can't remember this person's name. Oh, yeah, that thing at work that was stressing me all the time. Oh, look, I got my projects done. So you have to make sure you kind of start with what's manageable and tangible for you. So, you know, we would love for you to kind of come and see us and talk to us about it. We are doing consults as well. We do 20-minute consults on the phone or in person if you want to kind of talk about this or any other health issues you have. So please feel free to contact us. If you are interested in the Recode program itself, or we call it our Prime Cognition program, we are starting to move with that. A lot of what Dale Bredesen did in his program, we are already doing anyways. We're just sort of adding in his computer-based program along with it. So you might hear this Recode report and stuff. MPI Cognition is the one who owns the rights to that. So if you're interested in hearing more about that and doing more of that Prime Cognition brain training program, Denise is our online support. You know, she'd be happy to talk to you or email her, and she'd would love to hear from you and stuff. So I'll put the slide back up in a second and stuff, but there's our team. We all love working together and stuff. We have a great work environment and stuff. Next month, we're going to have some fun because it's Valentine's Day, just after Valentine's Day. So we're going to talk about the sex hormones and stuff. You know, we said this is really important for that growth, that trophic support, that type 2 Alzheimer's and stuff, where you lose that support of some of your hormones. So we're going to talk about, and you know, hormone replacement therapy was good, then it was bad, then it was good, then we don't know, and now it's targeted. That's the new guidelines. Targeted hormone replacement when you need it, if you need it, and you don't have to be postmenopausal or in andropause and stuff. You know, sometimes we need it earlier in our lives and stuff, and it doesn't mean always that we give you hormones. We give you lifestyle changes, and we'll talk about more of that to balance your hormones and stuff too. So thank you so much for coming out tonight. I'll leave this up in case anyone has some information. And yes, safe driving to all you guys home. Thank you.
And before you go, let's support So we have a few minutes for questions.